Hello, everyone, and welcome back to the Lube Tube. This is Jeanette and my co-host, Brittany. Welcome, Brittany.
Welcome, welcome, welcome. Welcome, welcome, welcome.
Oh, keep going. Welcome, welcome, welcome. Welcome, welcome, welcome.
Thank you. Thank you.
All right. So today's episode, we're going to be talking about weight loss medications and all that are available on the market for us to be using to help with weight loss. This is going to be an episode that is going to be super informative. And I hope that you'll be able to take these tools with you to your doctor's office and to be able to answer these questions for you, because the medications I talk about today are not for everyone. And I think that's really important to say, because I feel like there's a lot of ladies out there that have questions about these, but also need to understand that they are not for everyone. So we're going to talk about them all, and we're going to educate you on all of them. And I think you're going to really learn a lot. But this is an episode that a couple of ladies reached out to us asking before we, really got into the Lube Tube. But then recently we had a Instagram poll and we asked about different options as far as what they want to hear next. And this one won by like a whole lot. The next up, as far as like one that got second place, was the like nutraceuticals and kind of like things that you can take as supplements to help kind of with all different kinds of stuff. That's going to happen. A supplement podcast, I think it's going to be very beneficial, but we're going to go with this one.
I think it's a great idea. And just so everyone knows, this will be our last episode until the new year. So we're going to make it a good one.
Yeah. And don't miss us too much. I know you're going to really miss us, but don't miss us too much.
Get over yourself right now. So before we started this, we were talking about the rates of obesity, and they weren't shocking, but numbers are always fun. So remind me of the rates you just told me.
Yeah. So it is in America, 42%. Right? So 42% of the American population by BMI could be considered obese. That's a lot, right? And then Brittany said, well, I wonder what it is in just Texas alone. And the most recent study that I saw was in the 90s, and that was 33%. So I can't even imagine.
It's higher than that.
I know. So
higher than that.
Well, maybe not 100%, but it's higher. It's definitely higher.
It's definitely higher.
Yeah, it just sucks, right? And so I do think that these medications have been extremely beneficial for so many people, especially the patients that are maybe have diabetes or have prediabetes or high cholesterol or metabolic syndrome, right? Something that could be easily treated with just weight loss alone. But I just think that, like I said earlier, they're not for everybody, but they can absolutely help a lot of patients. So we're going to kind of dive into that a little bit. So basically defining what different weight loss medications there are, there's a bunch of ones, right? There's oral medications, there's injectable medications, there's what we call sublingual medications, which are dissolvable pills that you put underneath your tongue. And some of these medications have been around for a very long time, right? Like I think everybody has heard of phentermine. I know my mom has talked about fen-phen that was kind of given back in the late 70s, early 80s. And basically phentermine is a pill that is prescribed and it is a controlled substance. And what it does is it just literally increases your rate because your heart rate is going a lot higher than it normally does. And it's just making you feel like you're just not hungry, right? And so these patients tend to eat less and they actually are kind of burning through things a whole lot faster because their metabolic rate is going faster just because they're in almost like a sprinting. They feel like they're sprinting at all times.
And so these are essentially appetite suppressants, and they're also a medication that you don't want to take for an extended amount of time.
Right.
Which I think sometimes is hard for people to understand.
Yeah, because it works, right? It works for them. And they're like, oh, but I eat less when I'm on that. And I feel like I'm super focused when I'm on that. And I feel like I have all the energy in the world. Well, yeah, that's great, but that's not normal, right? And so what I always tell patients is that medications that are like this, which are appetite suppressants and kind of give you that kind of jittery feeling, they're not great for the heart, right? So long-term use of these medications can actually be detrimental to the cardiovascular system. And so I absolutely don't want you being on these medications for a long time. Can they kind of give you that jump start maybe that you need in order to try to get some of that extra weight off before really diet and exercise really starts kicking in? Yeah, I think they can be beneficial in that situation. But as far as a long-term chronic medication, that's absolutely not something I would recommend.
How cute that your mom called it Fin Fin.
Yeah,
Yeah.
that's what it used to be called,
I know. I think I
fen-phen.
remember. Yeah, I think I remember hearing that from other
Mhm.
people.
Right.
And there's something to be said too about people that are on Adderall
Oh, yeah,
and
absolutely.
people like what is it? Vyvanse?
Vyvanse. Yeah. And so Adderall is the short acting form. They do have an Adderall extended release. And then there's a newer one that's out called Vyvanse. Basically, it's basically the same compounded medication as the Adderall. It's the same exact like medication. It's just more of in like a situation where a little bit is dropped throughout the day. And so you get more of that long acting effect. And patients do take these for weight loss too. I mean,
Mhm.
and when I was in internal medicine, there were quite a few ladies that didn't want me to ever take that pill away from them because they felt like they kept their weight down while being on that medication because it
Right.
absolutely takes your appetite away completely.
Well, I think that would be called Addy for short, right?
Oh,
The
yeah.
Addy.
Addie.
The Addy. When I was in school, this was not happening, but now apparently in college, they can sell like one pill of Adderall for
Mhm.
like 25 plus bucks.
Oh my God.
I
That's
know.
scary.
I mean, it is scary. Also, like
Yes.
that is that's a business. Like
It is a business. And
for
honestly, like, hello, do we not realize that business is selling drugs? Like you're literally you're the
a
bad
drug
guy.
dealer. Oh
So
yeah,
I don't know if
I
I
would have been a
would
terrible drug dealer. I already know. I
I would have
know
been
it.
so bad. I would have been like up all night worrying if they had a heart attack if I on a drug that I sold them.
Yeah. No, and maybe that's a good thing. I'm glad we would be terrible drug dealers.
Right.
That's a positive.
We would
Okay,
be a
sorry.
lot richer. Sorry. Okay.
Oh, no. We always talk about how we could get rich. We actually haven't had a good idea yet. So
No. Well, we're rich in love, right? You tell
yes,
me that every day. So it's all
yes,
that
you can
matters.
that is all that matters. Thank you. Okay, so let's move on to the big daddies.
Yeah, absolutely. So I think it's important to understand what obesity is and how it's kind of quantified. So a BMI, which is body mass index, which God, I could get stuck on this. So BMI is basically your height and your weight. When it's calculated, you would get a number, right? And that number, anything over 30 is considered obese, where anything below that is something that's obviously either could be overweight or normal weight. But I think it's so crazy that we even look at BMIs anymore because it doesn't take into consideration height as far as a really super tall woman, right? Or it doesn't take other things like considerations as far as like with those super bulky women, right? Or women who are lifting weights and who are bodybuilders, right? Their BMI is going to be stupid high. But are you going to tell me that they're obese because their BMI is over 30, but they're full of muscle? I don't know, right? So the BMI is something that, as much as I hate to say it, we as medical professionals go off of. And in a lot of situations, we can't get these medications covered by insurance unless the patient has a documented BMI over 30, right? And so these are all things that we have to document whenever you come and see us. And a lot of women obviously do not want to get on that scale. But if we're going to talk about obesity and we're going to talk about weight loss, these are things that we have to actually have calculated in order to kind of get you these medications. They can also be covered if they're like BMI is less than 27, or excuse me, greater than 27, and they have other comorbid conditions, right? So say they have diabetes or say they have high blood pressure or high cholesterol. A lot of times we look at that too, because just because their BMI is not over 30, these other things can obviously add to their unhealthiness, right? So talking about like insurance approval, it all comes down to FDA approval things, right? So medications that are FDA approved, the Food and Drug Administration approved weight loss medications. And we had already kind of talked about a little bit about the appetite suppressants and how these kind of work. And basically, they affect the hunger signal going to the brain, right? So you're not going to feel hungry at all. And you're going to just also have a little bit higher of a pulse, and you're going to almost sometimes feel a little bit jittery. And in these situations, patients are just not thinking about eating food, right? So they're doing the exact opposite. They're just kind of going on with your day, getting things done. And then they'll be like, oh, I forgot to eat today. I mean, I can't tell you the last time I forgot to eat, but it happens, right? When you take these medications. The other big one, and I think this is the one that most people are probably listening to this episode to talk about, is the GLP receptor agonist. Okay. That is just a really big term for glucagon like peptide receptor agonist. So these are going to be your injectables. Okay. These are going to be the medications that have been out honestly for a very long time. The original and the OGs of these medications were a medication called Byetta, which was used for diabetes, and it was an injection at that time. And then the next one that came out was something called Bidurion, which this was also an injection that you gave yourself. And I don't know, Brittany, if you've ever seen the original Bidurion injection. Have you ever seen that pen?
No, is it ginormous?
It is. It's literally ginormous. It's almost 9 inches long. So it's like a big pin. It's almost like a foot long pin.
Wow.
And you used to have to put it together and then kind of twist it. And then the liquid would kind of meet with the powder. And you had to sit there and shake it for 30 minutes before you could actually inject this medication. And it was a one-time, one-use pin. And it came in a huge box where the patient had to actually put the pin together. And so the amount of times that I actually get a patient to say, yeah, they'll use this medication for their diabetes or they're not afraid of it was really low. Nobody wanted to be on this med because A, they had to put it together. B, it was a huge needle. Like we're talking a big needle. And it would leave these like little whelps on the skin. And they were these little particles that would break up over the next week that would help with the diabetes. And that's kind of how this whole class kind of started.
It sounds like it was like a shake weight.
You
I
remember
mean,
those? Do you want one for
absolutely.
Christmas? I have one.
Uh, do you really have a shake weight?
No, we have one at the
Jeez.
office. I
What?
think,
Oh
yeah,
my gosh. Those
I
are
don't know why.
archaic.
I think
That
one of the docs gave it to another doc as like a gag gift one time. So it just sits in our office.
that's cute. I'll remember that when I need
Yeah,
an arm
come on
workout at
over.
work. Yeah.
Come on over. And so, originally these medications were used for diabetes alone. The next one that came out was a medication called Victoza. Victoza is a once daily injection, and it was used for diabetes. And what people were finding out was, hey, I've been on this med for a while and I'm losing weight. Like, is that normal? And it is. It is a normal. We knew it was going to be a normal side effect from this medication. But as this started to get more and more popular, people were like, how could we remarket this and rebrand it as a weight loss drug, right? So then shortly after that, Ozempic came out. And Ozempic is Victoza, and it's now just more in a once weekly pen rather than it being in a daily pen. And people were losing significant weight with the Ozempic. And so that's when marketing was like, hey, I know what we can do here. What if we now make this more of a weight loss medication? So they did studies on it and they found that people were actually losing a good, I can't give you the exact numbers, but it was like 20 plus pounds. And people were losing that significant body weight, which was then helping them get to their goals, right? So then they were like, hey, let's remarket this. And that's when we have the good old Wegovy, okay? Wegovy is basically Ozempic, but remarketed as a weight loss drug. And it's a once weekly injection as well that is only covered by some insurances and only if your insurance has an obesity plan on it. And you have to have a BMI greater than 30 with documented basically documentation that shows that you've been working for the last 6 months in order to try to lose weight. And that could be seeing a dietitian, that could be weight loss, exercise. It could be healthy eating habits. And we have to actually document that in order for insurance to actually get that to be covered. And I'll be honest with you, very rarely can I get that medication covered.
Right. So you're saying that Ozempic, just for the clarity, Ozempic was originally a diabetes drug. And they were like, whoa, all the peeps are losing weight. Let's
Mhm.
remarket this so we can make more money.
Yep.
And that is what Wegovy is, essentially.
That's exactly right.
That is wild, but not
I know.
shocking. Our pharma market is it's interesting. I used to work in it
Right.
and
Yeah, I
I
know.
I don't think that this just doesn't shock me at all.
Yeah. And that's the hard part, right? Is because the shitty part is these meds work, right? They work really, really well. And so people know that and they want to be on that and they want to be on it, but then they make these stupid expensive drugs and then our insurance won't cover them, right? So then patients are paying out of pocket for these name brand medications, which is going to cost you almost $1,200 a month if you want name brand Wegovy, right? And now Ozempic will only be covered under a type 2 diabetes diagnosis for most insurances. And your A1C has to be something like over 7.5. Where if I know you know that that's not diabetes anymore. That's actually way over pre-diabetes. Now we want an A1C less than 7. And now they're saying they won't cover it until it's a 7.5. So we're essentially just waiting till you have other issues from your diabetes before we'll cover a medication that I know will work, right? So, well, this could be a big soapbox. So I should probably calm down on that.
Yeah, this is obviously I want to be very careful on how I say this, but I read an article today about how obviously you know about the CEO of United
Right.
Healthcare.
Right.
And I mean, what happened was terrible, but
Sure.
that people are so upset with our insurance companies that there are people that are willing to pay the guy that was charged with the murder. They're willing to pay for his legal fees. There's
Oh
people that are
my
reaching
God.
out to his lawyer saying, "We'll pay for his legal fees." And I mean, that's
Wow.
there's nothing right about what he did. I mean,
No,
this poor guy, there's a wife and children involved,
I
but
know.
it
I
just
know.
shows how fractured our
I
healthcare
know.
system is in regards to insurance and things like Ozempic, things like
Right.
Wegovy. It's
Right.
just there are people that really need this medication
Mm-hmm.
and they're supposedly just not meeting the quote unquote criteria.
Right.
But this could mean big changes for a lot of people and they're just not being
Absolutely.
granted that access.
Absolutely. Absolutely. That's actually really sad, right? Thinking about just the humanity part of that is just
Mhm.
is kind of it's just actually really, really heartbreaking. Um, but I don't know. I'm going to get off of that subject because that's really sad.
I know,
Okay. But
sorry.
anyways, another diabetes medication that came out shortly after Ozempic is a medication called Monjaro. Okay. Monjaro is both the GLP-1 that we know of that we've already just talked about, but also it has a GIP in it, right? Which is a different type of receptor agonist. And so you're getting actually two types of medication in that injection. And that's also a once weekly injection. That medication is only approved for type 2 diabetes. In the beginning of Monjaro, it was being approved and on some insurance plans under weight loss or, excuse me, obesity, things like polycystic ovarian syndrome or PCOS. And it was approved for a little while under a pre-diabetes diagnosis. But now insurance has kind of caught on to that. And they're like, absolutely not. I'm only paying for a type 2 diabetes diagnosis for somebody to have Monjaro. And so just like Ozempic, they were like, hey, look at all this weight loss that's happening. Let's go ahead and make a weight loss drug out of this one. And that's where we now have Zepbound. Okay. Zepbound is basically
Where the hell do people
Monjaro.
get these names?
Oh, right. I think that we got that one because Zepbound, the compound of that is terzepatide, right? So the Ozempic is semaglutide, where Monjaro and Zepbound is terzepatide, right? So I guess that's where they got it, but yeah, I get it. These drug names are so weird. So, anyways, that medication is also needs specific insurance coverage, and you have to have all the documentation that I previously mentioned. And getting it covered by insurance is a headache. It requires multiple prior authorizations, and then the patient's frustrated thinking that our team isn't doing the prior authorization correctly. But it comes down to just their insurance just flat out will not cover it. And so, in many situations, we have to get these medications compounded, right? How they work is they basically actually work in 8 different ways in the body. I'm going to be very upfront and honest. This medication and this class of drug is phenomenal, right? It has done amazing things for a lot of my patients. It's gotten type 2 diabetics down to one medication and that being the only one. It's gotten people off of insulin. It's gotten people turning their non-alcoholic fatty liver disease into a no issue thing. We're talking people that have stage 2 and 3 liver disease, bringing it back down to stage 1 or 2, just with the weight loss that's associated. We're talking about reducing cardiovascular risk. We're talking about reducing renal or kidney risk. There's a lot of really great benefits to this class of drug. But until we get insurance to kind of catch up with us and realize that, hey, more people need to be on this, obviously, with the 42% of Americans that are obese, we are going to end up in a situation where we have to find workarounds, right? And the workarounds are people using compound pharmacies. And compound pharmacies are where they're taking these medications like Ozempic and Wegovy and compounding the original form of that medication, which is the semaglutide or semaglutide, right? And so they're using these pharmacies to basically make this prescription, and then they send it to the pharmacy, or they send it to the patient from the pharmacy, or patients are getting it from their actual provider at the clinic and going in and getting their injections. And it really just depends on how your provider chooses to do it.
So when we're talking compound pharmacies,
Hmm.
specifically when we're talking about these, I think maybe an easy way to understand this for someone who's not familiar with a compound pharmacy is that it's almost like, and I feel like this analogy is pretty close. It's almost like they're making a generic version, if you will, of the medication in that it has the same mechanism, but it's not coming from the same manufacturer. It's not this same exact recipe, if you will, but it's doing the same thing.
Exactly. So if you were to look at a name brand medication and you were to look on the actual bottle, it's going to say the name brand. And then it's going to say what medication it actually is. So, for example, there's a medication for blood pressure. It's called Toprol, right? That actual medication, the name brand is called Toprol, but the actually medication that has been studied is metoprolol. Okay. So it's like basically giving that name brand and taking that name brand off and just giving the actual medication itself. And so the way we're getting around that is just not using big pharma, right? And big pharma does not like that, right? And they are pissed off about that. And so using these compound pharmacies, what we're able to do is we're able to get these medications for these patients. The downside is patients are going to have to pay cash, right? The upside of that is more patients are getting it in their hands and they're able to actually be able to use these medications. So I do think that there is a place for these compound pharmacies. Saying that though, do I think that there are compound pharmacies that do a really crappy job and don't have patient interest first in line? Yeah, absolutely. I think there's compound pharmacies out there that are literally probably putting whatever they want into that compound because they can, and then basically selling it on Facebook, right? Or some sort of social media and selling it for hundreds of dollars, and patients are not getting the actual medication, right? So you have to make sure that the person that you're seeing and being prescribed this by trust the pharmacy that they're using, right? And you have to be able to trust the pharmacy that is being done as the patient too, right? Because people are crappy, right? So it's important that you have these conversations with your provider.
Definitely. And that you trust them well enough to know, okay, if they're going to send me to this compound pharmacy, it must be legitimate. It's also easy to ask, like, how have your other patients done? What's the
Yep.
success rate been?
Great,
That's,
solid question.
mhm. I
And you
also,
want somebody who's going to want to see you, right?
yeah,
You're not going to just want this prescription called in for you and then you never follow up. In my clinic, when I see you, I'm going to get some baseline blood work. You're going to come see me. I'm going to prescribe the medication if you are a candidate, and then I'm going to send you the prescription. You're then going to get it sent to you if we go the compound route. If we go the name brand route and it gets covered, you're going to go pick it up at your local pharmacy, and then you're going to follow back up with me in 3 months. That's what you're going to do. And you're going to see me every 3 months as long as you're on this medication because A, I want to make sure it's still working for you. B, you're not getting bad side effects like constipation, nausea, vomiting, some of the bad GI upset that you can get with these classes of drugs. And then C, I want to make sure you're not losing too much weight, right? Because these drugs work really well. And the last thing I want you to do is lose too much weight on this medication.
right. And I think that's one thing that has kind of been in the media
Hmm.
and just like in everyday life is you see somebody that has clearly been on one of these medications, and most people will tell
Hmm.
you, although for whatever reason there seems to be like a little stigma where people don't want to tell people that they're on it,
Right. Right.
but that's personal choice. So
Sure.
they tend to have something that has affectionately now been called the Ozempic face, where we're
Oh,
having these
yes.
sunken in
Hmm.
cheekbones where you can
Hmm.
just tell like skin is just kind of like fallen off, if you will.
Well,
And
let's talk about why that happens, because eventually that's no longer taking away the fat, right? At this point, we're now taking away muscle mass. And that's one of the biggest problems with these medications, especially if you're not being followed by a provider, is it's taking away your muscle mass. And as females, like we've talked about in multiple episodes, our muscles are our best friends, right? And so they're going to help create more bone mass, right? They're going to help us stay healthy. They're going to help us stay strong. And so if we're eating away those muscles, that's why we have that skinny fat look, right? Because you want to have some definition left.
skinny fat.
Skinny fat. You like that?
Yeah, I know. I've heard that before. You just said muscles. It just reminded me, we haven't talked all day. And guess who I saw at the gym?
Who did you see at the gym?
Who I've seen at the gym before. And
stop it. You saw him there?
Yeah, I mean, I can say it. I saw this guy that I date. I wouldn't even say did I date him?
Yeah.
I guess I did.
Well,
I
y'all
did
went
date
on
him.
a couple dates. Yeah.
Yeah. Yeah. And Jeanette actually
Oh
knew
my
him.
God.
And I just see him at the most awkward times, like where I'm like lifting and like where you don't want anybody to be looking at you, like where you can barely breathe. And then like he was just standing there. And I don't know. It made me leave the gym early.
Oh my God.
I gotta go. I saunaed and I got out of there.
But can we talk about the fact that you said you were dating that guy and I totally knew who it was before you even told me who it was?
So
that was
creepy.
weird.
No, I hated that. Actually, no, I liked it because it's always nice when you're dating someone and you kind of have an insider,
Absolutely. I was like, I know exactly who it is. And you were like, no, you don't. And I guessed and you were like, what the fuck?
No, that was so weird. That was so weird. And then I was like, we're no longer dating.
You're right.
And you were like, thank God.
Exactly.
Good times, but I still see him at the gym when I'm just trying to work on my muscles. So,
maybe he's following you. That's weird.
Oh God.
Okay.
Please. Jesus. No.
So I do think it's also important that we talk about some other medications because obviously these GLP-1s are not for everybody. GLP-1s are going to be for the people that have been working out, they've been exercising, and they're just not losing as much weight as they want to be. Or they're extremely obese and they can't exercise because it hurts, right? So they have to get some weight off of them so they can actually start exercising without having so much joint pain. I also think that they're not good for people who have any history of like gallbladder issues because it can actually worsen the gallbladder issue. They are contraindicated in anybody who has had pancreatitis because they can actually lead to further pancreatitis. And they're also contraindicated with anybody with a specific type of thyroid cancer. So that was only found in rats. So I don't want people freaking out about getting thyroid cancer from this med because that med has actually not shown any thyroid cancer in humans. It's only been found in rats. But next thing are the oral medications that we kind of talked about a little bit earlier, but there are two that I really want to touch on. There is a medication that's a combination pill between phentermine, like we talked about earlier, and topiramate, also known as Topamax. Okay, this is a migraine medication. But they found that by putting these two together, they actually could create a medication that was really good for weight loss called Qsymia. This is another one of those medications that I don't want you to be on for a very long time. I want you to be on this for a very short period until you lose the weight that you're hoping to lose, and then you keep it off with your diet and exercise routine. But it has a lot of the same side effects as the phentermine. It's going to cause the jitteriness. It's going to cause the racing heartbeat. It's going to cause you to be like super focused. But it can also cause significant dry mouth. And one of the most funny, I guess, is a weird side effect of this medication is interesting, but it's also kind of funny is when you drink a soda that you like really love, it tastes awful. It makes the soda taste awful. So like my patients always report if they're on this, they'll be like, I just love a good Diet Coke. And when I drink the Diet Coke, it tastes terrible. And so I always think that was so interesting or funny because it's like the one thing that you really want and you're craving and then you go drink it and it just tastes absolutely disgusting. Just thought that was interesting.
I could have benefited from this in high school when I had a Dr. Pepper addiction.
It doesn't make Oreos or Pop-Tarts taste bad though. So
whoops.
Won't work for you. The next one is a medication called Contrave. And this is also a pill form medication. And this is one that we actually have to start really low dose and we work our way up. So it starts at one a day. And by the end of that medication, you're up to 4 pills a day, 2 in the morning, 2 at night. And I don't know about you, but a lot of people don't want to take that you take care of that. A lot of people don't want to take twice a day dosing medications. It's just not their thing. It's a once a day dose kind of thing, or they're not going to end up taking that second dose. And this is a combination between naltrexone, which is a med that's commonly used for opiate addiction, and to actually help with getting a specific opiate off the receptor of the brain. And it's also used or the other medication is also used for depression. It's the bupropion, also known as Wellbutrin. A lot of insurances will not cover the Qsymia or the Contrave. And those medications work out, if you were to pay cash for them, anywhere from $100 to $200 a month. You can get the Contrave. I have done this a couple of times. I've gotten that compounded, just like we mentioned earlier, at a couple of the compound pharmacies. And we just basically have to do the naltrexone with the bupropion and get that compounded at a local pharmacy where they can make it for you. These work really well. There's no contraindication with this medication as far as being on it long term. There's no cardiac problems with being on this medication long term. Contrave is not going to give you that jittery feeling. It's not going to make you feel uneasy. It's not going to make you feel anxious. What I do say is that patients that take bupropion, right, already. So maybe you come to me on Wellbutrin, then I would just do the naltrexone alone. Okay. So say you're already on Wellbutrin, but you really need some help with the weight loss, then I can actually add on naltrexone to your Wellbutrin and still get the same effect of the Contrave. So that's kind of a good thing to know. As far as the Qsymia works out to be about $100 a month. And most pharmacies, actually local pharmacies, don't have it. They use a pharmacy called Medvantix, and that medication is actually prescribed through the mail and it's mailed to you. And like I said, it works out to be about $100 a month, and most insurances just do not cover it. And there's multiple doses of that, and it's actually the more of the topiramate that we're kind of dosing differently. The phentermine as well, but it's mostly the topiramate that we have to kind of work your way up with that. Last one, and I can tell you, I've never prescribed this before, but it's an old medication. It's called Orlistat. Orlistat is a pill. Another one is called Alli. I'm sure you've seen, it used to come in like a little tub and it's like a powder mix. Alli is used to basically in the gut block the fat absorption. Okay. So say you're eating a fatty meal, it's basically going to block that fat from being absorbed through the intestine. Downside of that med, terrible diarrhea, right?
Oh,
Like
that's a big downside.
Yeah, big. And you're like literally just pooping fat, right? Ugh, right? So that's kind of gross. Um, yeah, right. So most people don't stay on this medication. I haven't had anyone that came to me on it, or like I said, I've never prescribed it just because it has such a significant side effect. So that is something that it's available though, just so you know. There also is the GLP-1s, like I mentioned, like the semaglutide. They are now available to do a sublingual version. The prescription name of that medication is called Rybelsus, and it is used for diabetes. But now they are compounding it as a sublingual or underneath the tongue. And I'll be honest with you, I haven't seen that great a weight loss with it. I've seen a good 10 to 15 pounds, but nothing I'm seeing with the other ones. So that's a sidebar.
I remember seeing that one on the television.
Yes.
So when we're talking about these weight loss medications, I think there's benefits and then there's some limitations to them as well. So benefits is for those people, like you said before, who have done the lifestyle changes. They've done all that they think they can. We do see increased weight loss with this, as when you're comparing it strictly just to, I did these lifestyle modifications, I'm eating better, I'm working out more, I'm still not seeing anything. They get put on these medications and they do see weight loss.
Right.
And we also, like you mentioned, it improves people that are having issues with diabetes, hyperlipidemia, sleep apnea, things of that nature, hypertension. All of those things can be improved with, and it's not necessarily because, I'm finally on this weight loss medication. It's because of the weight loss too, right?
Right. Absolutely.
And then there's also like the psychological benefits that we see where someone, has lost 10, 15 pounds and they're like, I look fabulous. I just feel better, and that is a great thing. And so there are all these great things, but there's also some not so great things that we can see. And I mean, just side effect wise, the profile can be pretty vast, but I know we see a lot of nausea, a
Sure.
lot of like GI issues, obviously, because that's we're
Mhm.
working on those receptors. And then we go to the cost. And that
Mhm.
again is, I think, for people that have tried to get this medication and have not been offered the compound option, it really is a big decision. Like, what's more important to me right now? And
I
that's what
know.
I guess that's the sad thing is, it's, do I spend, 1,000 plus for a
God,
month for a drug to potentially lose weight and maybe be in better health? Or do I put groceries on my
I
counter?
know.
You
I
know?
know. And there are going to be people that make that hard decision and they spend that money, which it's a lot of money and not everybody has that. And
Right.
do I think that these compound medications have created an availability for patients that can't do that? Yeah, I think it's great. I think it's awesome. They just have to be done in a safe way. And you have to find a pharmacy that you obviously trust.
Right. And then also these medications are not for everyone. When I have a patient come in and when I could guess her percent body fat is below a certain number, I don't think she's appropriate. But if I tell her, no, we're not going to do this for you, there's a good chance she could go to, like you said, another resource, whether that's online or, you know, another, I don't, I'm, I'm just speaking hypothetically, but another
Yes.
clinic that
Mhm.
is willing to say, hey, give me $500 and I'll make that happen for you. Right.
And that is the scary part, right? Because
Mhm.
anything, people will do anything for money, right? And sadly, it's happening in the medical world, right? And they will take your money and they will give you these injections, and then they will tell you, "Oh, we can't have you do these injections by yourself, and I'm not going to teach you that. But if you come in once a week and then you add on these other supplements, we can make you lose the weight that you've been wanting to lose." And people that are in situations that they want to lose that weight, or they feel like they have to lose that weight for their health, they're going to do it, right? And so you need to find somebody that you trust, right? In order to kind of make this happen and make this happen for you in a safe way.
Yeah. No, I had an aunt
Hmm.
who called me one day and said, hey, what do you think? And she talked to me about her situation. She was going to start pellets and she was going to start a compound.
Sure.
Guess how much she told me it was going to be?
Just for the compound.
Per month. No, for both of those. So pellets and the compound.
Mm, I mean,
It was over a thousand. It was
$900.
it was over $1,000.
See what I
And
mean? It's
you and I both
ridiculous.
know that is per month, that is absurd. But
That's absurd.
again, people are having to make this decision. What is most important to me? And it's just, man, it's a slippery slope. That's all I gotta say. That's
Yeah,
really it.
it is. It
So
is a slippery slope.
okay, let's move on because you and I can keep going with this as we know.
Yes.
Okay, what about some myths about weight loss medications?
Yeah. So there's a lot of myths out there that, hey, what happens if I get on this medication and I just want to get off of it and after in like 3 weeks, right? Well, okay, you might lose that weight that you maybe want to lose for a wedding coming up or some event that you want to lose weight for. But if you don't do this correctly, that weight's going to come right back on, right? If you're not making those lifestyle modifications during this time while you're on this medication. And a lot of people are saying, well, that's unsafe. Well, like we mentioned earlier, some of them, yeah, like the phentermine, not long term, right? Not good for everybody. If you have heart conditions or high blood pressure, you shouldn't be put on that medication, right? But as far as some of the other medications, if they're prescribed by a qualified medical provider and somebody who knows what they're doing, they can be completely safe, right? So I don't think that an unsafe word is basically should be used in this situation. So a lot of people are also asking like, well, why do I have to have a prescription for it? When is this going to come over the counter? Right. I don't ever see that happening. Especially with this newer class of drug. Well, A, the phentermine is a controlled substance. That's never going to go over the counter. B, topiramate with the Qsymia and the phentermine, that's also a controlled substance. So that's never going to go over the counter. If you want to take Alli and poop all day, you can get that one maybe over the counter, but that's not something I would recommend. And then last but not least, these GLP-1s, I just don't think they're ever going to make over the counter because there needs to be following with these meds, right? People can go overboard and like we said earlier, lose way too much weight. And we don't ever want to get you underweight. That's not the goal because then we start thinking about malnutrition, right? Start thinking about deficiencies, start thinking about what that does for the heart and anemia and other things that can happen. So being followed by a medical provider is obviously a good idea.
Okay. It's about that time.
Ooh, for what?
Slippery
solutions. Brittany,
with
we
B
really need to work on this.
and J. I
Jay.
almost feel like we need to get
Oh
something to like
my.
insert where like we can just press a button and it goes.
Yes, that would be much nicer than us trying to do this every time because it sounds like shit. Like that birthday card that you gave me last year that says, we really need to stop singing happy birthday to each other because we really sound like shit.
Oh, man, I'm so kind. I am really that girl.
I mean, I liked it enough that I put it on my fridge. So there's that.
Okay, so let's get into it.
Okay, bring it on. Let's go.
All right. My boyfriend and I aren't planning on having kids soon, but when discussing it for the future, I fear that maybe I won't be able to since we are waiting. I'm 25 now, planning on maybe late 20s or early 30s. Plus, he is scared that his sperm might not be as good due to him doing a lot of drugs in the past. Can we test for this? And when would it be a good time to make sure we are both okay for when we decide to get pregnant?
Great question. And I get this a whole lot. But girl, you are so young. Do not worry about that right now. Okay. So at 25, your eggs are still, still great. So don't worry about that. If you really wanted to get some testing done on him, we could absolutely do a sperm analysis that looks at the motility and the mobility and how much of sperm he has. But what's important for us to remember is he is doing what we call spermatogenesis, where he's making new sperm all the time. Where females, we are born with the amount of eggs that we're going to have, and we're not making any new eggs. So whatever he did in the past is not going to affect his sperm that he has today, right? So don't want you to worry about that. Right. So, what I would say is that y'all need to really sit down and decide, hey, is this something that you are thinking about in the next year, 2 years, 3 years, and kind of get an idea. And if it's not for, a long time from now, then maybe if y'all are thinking maybe not getting pregnant until late 30s or maybe mid 30s, that there is the option of freezing your eggs. Right. And not a lot of people talk about that, but that is an option where you go to fertility and they literally go in and do an egg retrieval and they're able to basically freeze or harvest these eggs in order to be able to use them for later. So at 25, I wouldn't be too concerned. And if you were really worried about it, you could always do a sperm analysis on him.
Yeah, and I agree that it's a good point that as women we kind of have, and I hate this word, but we kind of have a I'm not going to even use it.
Okay, got it.
From a fertility standpoint, it kind of pisses me off. But we have a limit of sorts, right? Where our eggs there's only a certain amount of number, and then the quality also changes.
Mm-hmm.
But for our guys, I mean, let's look at Robert. Was it Robert De Niro, where he's like, is he in his 80s and he has a child?
Oh God!
So they can. Yeah. Oh, with like a young girl.
Oh, okay.
Like I want to say she's like 20.
Okay.
I mean, older than 20, but like not older than 30.
Wow.
So she's between 20 and 30. And I want to say he's 80, 81.
Oh my gosh.
But that's just a valid point that our men can
yeah, absolutely.
Some swimmers for
a long time.
A long time.
Absolutely.
Yeah. Okay. Thank you, Jeanette.
You're welcome.
Appreciate you. So this next one, this actually happened to me today.
Okay.
Today I was asked this question.
Oh, ready.
And I didn't know the answer.
Okay. And you think I will?
Well, I'm going to be interested to see if you do.
Okay, let's go.
So I had a nurse say, Brittany, are you familiar with a blue waffle?
What? Where the hell do you come up with this shit?
A blue waffle.
Okay. I'm ready.
Before looking this up, by the way.
Okay.
I didn't look it up.
Did you look it
I
up on
just said,
Urban
yeah,
Dictionary?
literally, that is what you need to do for this because apparently it's a made up thing.
Oh, okay.
But I was told it was when you have
Oh, God.
syphilis and gonorrhea.
What? What?
But when you look it up, apparently
Googling
the
now.
term waffle it's a slang term. We're not talking about, are you looking it up?
Of course I
It's like
am.
you're looking it up. Yeah, when we're talking waffle in slang, probably in the Urban Dictionary world, that's a slang for vagina. And a blue waffle is when there's a serious vaginal infection.
Oh, wow.
Blue waffle disease was rumored to cause lesions, bruising, and blue discoloration.
Okay, so I
But
Googled it and
apparently
it says blue waffle is an internet hoax.
Yes, exactly.
Some claim it is a sexually transmitted infection that turns the vaginal area blue. However, blue waffle disease is not a real medical condition.
Okay, good. Well, I'm glad we have debunked
I am,
blue waffle.
but I'm really excited about, whatever you do, do not click the images. Don't do that. Whatever you do, don't do that. Ladies, if you're Googling this, do not click the image button. But anyways, I'm so glad that we talked about this because I'm going to probably have somebody come in and ask me if they have a blue waffle.
Listen, the more you know.
The more you know. So thankful for you.
Thank you. All right.
Oh.
So I think we should kind of wrap it up.
Yeah, I think we should end on that. Nice.
Okay. You didn't want to like do like a conclusion?
Sure.
Like,
I just now can't get the damn image out of my brain, but absolutely.
Okay. So let's move away from the blue waff.
Okay. Waff?
And,
Can we not call it a waff? Okay. Yes.
Because waff kind of sounds like wop.
Oh, yes.
We know that Megan the Stallion.
Yes.
Told us all about a wop.
All you need is that vaginal estrogen cream.
Amen. Amen. Okay, so when we're talking about weight loss medications,
yes,
we know it's all the rage right now.
Correct.
But there are certainly factors that play into who actually can benefit from this, and who doesn't really need it.
Right.
I mean, I feel like there are certainly lots of factors that go into this.
Absolutely. And that there's different options, right? So there's the injectables, the oral forms, and there's all different classes of drugs. And honestly, this is just a provider question that you need to have because you need to sit down and talk about, are there any contraindications for you to take these certain medications and which one, if we need to take one, is the best one for you? So it's important that you talked about possible side effects, how to obtain the prescription once it's written, the cost of the medication, and then honestly, just having really good follow-up because the follow-up, in my opinion, is the most important part because it's important that you are getting the medication and it's actually working for you and it's not doing too much as well. So yeah, I just think that it comes down to now that you're educated about it, having that conversation with your provider.
Preach.
Yeah, girl.
Yeah. Well, this has been great.
It's been so great.
I look forward to talking to you in a few weeks, but I'll talk to you before then. But I mean, like on the pod.
Oh yes, we won't be back until 2025.
It's crazy. Merry Christmas to everybody. Happy holidays. Happy Hanukkah.
Yes.
I don't know is there another politically correct thing
Kwanzaa.
you're supposed to say? Kwanzaa.
Yes.
Happy New Year. And
all the things.
That's all I got. Oh, Feliz Navidad.
Feliz Navidad.
Oh my.
You like that?
All right, y'all.
Thank you.
Talk to you soon.
Bye.
But later. Bye.
The information provided in this podcast is for general informational and educational purposes only, and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare providers with any questions you may have regarding a medical condition. There is no provider-patient relationship formed. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. The hosts, guests, and producers of the podcast Do not assume any liability for the application of the information discussed. Reliance on any information provided by this podcast is solely at your own risk.